Good evening, everyone. So today we'll discuss little anatomy and little TCM. Some part of the anatomy and some part of the TCM we'll discuss today. In the previous class, we were discussing about the two type of paralysis,
Ischemic and
flaccid and spastic. हमने पिछली क्लास में दो प्रकार की पैरालिसिस की बात की थी। एक थी फ्लैसिड और दूसरी थी स्पास्टिक। Flaccid paralysis means lunge punj ढीला, loose. That is flaccid paralysis. Muscle tone decreased. Muscle tone decrease हो जाती है. Muscle reflexes reduce means muscle is not working properly. Muscle की ताकत कम हो जाती है. Muscle strength is becoming weak in the flaccid. Right? So we have to tonify the point. हमें point को tonify करना होता है. On the other side, if we talk about the spastic paralysis, the muscle tone increase. Muscle थोड़ा सा टोन बढ़ जाती है, स्टिफ हो जाती है, कड़क हो जाती है. Muscle is getting stiff, more tone. So we need to set it the point. So that is the spastic paralysis. Let's see the image. This is the image of spasticity. कि कैसे स्पास्टिसिटी में हमारी फिंगर मुड़ जाती हैं और आराम से सीधी नहीं होती. वी आर नॉट एबल टू स्ट्रेटन very easily. They are very, very tight. So this is called spasticity. We can see more images of the spasticity. Like we can see, there are many patients suffering with a different type of the paralytic positions, spastic positions. Like we can see here, adducted shoulder and internal rotation. कि शोल्डर पास आ गया और अंदर की तरफ घूम गया. So many person having this pattern. In the TCM, we have point for everything. For the shoulder, for the elbow, for the wrist. So adducted shoulder, this is the abduction. And this is the adduction. So adducted shoulder with internal rotation. So this is the adduction and internal rotation. So this is the paralysis. The other images we'll see now. We can see flexed elbow. Flex हो गई elbow, आराम से खुलती नहीं है. There is a flexed elbow. Flexed wrist. Flexed fingers. Right? And the thumb is going inside. अंगूठा भी अंदर जा रहा है. Thumb is moving inside. We can see thumb in the palm. And clenched fist. मुठ्ठियां बंधी हुई. Arm in the pronation. So in this way, these all are spastic condition. And what is the flaccid? Flaccid means just opposite, loose. Like we can see, there is no grip, no muscle tone, loose. So when the person is having this type of the spastic condition, we need to tonify the point. हमें points को tone करना होता है. But the person is having flaccidity, then we need to tonify the point. So what is the cause? Why the person is getting spastic condition and why the person is getting flaccid condition? This is called due to upper motor neuron, and this is due to the lower motor neuron. Simple condition. Upper motor neuron responsible for spastic condition. Lower motor neuron responsible for flaccid condition. So this is the brain and this is the spinal cord. When there is an injury in the brain and the spinal cord, maybe some trauma, maybe some injury, maybe some hemorrhage or bleeding. Okay, maybe something wrong here in the brain and the spinal cord. So this is called upper motor neuron. Upper motor neuron. So because of the brain and paralysis, because of the brain and the spinal cord, if something wrong in the brain and the spinal cord, then they will increase the muscle tone. तो muscle tone increase हो जाती है because we know brain, spinal cord, all are controlling the different muscle. I want to lift my arm. So the message coming from the brain to lift the arm. But if there is any problem in the brain and the spinal cord and the upper motor neuron, then person will be suffering with a spastic paralysis, spastic condition, spasticity. What is the lower motor neuron? So after the brain, so brain and spinal cord we have talked about. Now the nerve starting from the spinal cord and going to the muscle. So they are not coming from brain. They are starting from the spinal cord and going to the muscle. They are called lower motor neuron. If there is no any problem in the brain, if there is no any problem in the spinal cord, if only the problem in the lower motor neuron, and if paralysis happened, so the lower motor neuron are creating loose muscle tone or the decreased muscle tone. Condition flaccid paralysis. इसमें जो पैरालिसिस होती है वो कौन सी होती है? फ्लैसिड पैरालिसिस. So we have to tonify the point. So here it's very clearly mentioned. Upper motor neuron syndrome create spasticity, rigidity, flex arm, flex elbow, flex finger, clonus. Okay. So many person suffering with a stroke and many other diseases can create this problem, right? So this is the spinal cord. We can see this is the spinal cord. And from the spinal cord, the nerve is coming out and supplying the muscle. But if this message coming from the brain, some disorder in the brain, some problem in the spinal cord, then it will create spastic paralysis, right? But brain and spinal cord are healthy, and the problem is in the lower motor neuron, then it is flaccid paralysis. We understood now. Okay. So we can see this is the flaccid condition. Flaccid condition means lunju-punju, everything lunju-punju. Now, in the TCM, it has been explained there are many pathogenic factors are creating the disease. We know wind, heat, hotness, humidity, dryness, and coldness means wood, fire, earth, metal, and water. So wind can create the disease. Wind might be good or bad, heat might be good or bad, humidity might be good or bad, dryness, coldness might be good or bad. ये जो एनर्जीज हैं ये अच्छी हो सकती हैं जब बैलेंस है, और ये खराब हो सकती हैं जब इम्बैलेंस है. So wind is more can create lots of problem. Heat is more can create lots of problem. Humidity or the dampness is more can create lots of problem. Dryness is more can create lots of problem. Coldness can create lots of problem. When these energies are creating problem, we are telling them pathogenic factor. ये खुद ही पैथोजन है. अभी बाहर से वायरस की जरूरत नहीं है. कोल्डनेस ही काफी है बीमारी पैदा करने के लिए. डैम्पनेस ही काफी है बीमारी पैदा करने के लिए. So our these pathogenic factors are creating lots of disease. The list of the disease which is created by the dampness, dryness, and coldness. But right now we are talking about the stroke. So let's focus first on wind, right? पहले हम wind पर focus करते. So when we talk about the wind, we can divide the wind in two parts: external wind and the internal wind. एक्सटर्नल विंड का मतलब है कि बाहर हवा चल रही है, या देयर आर बैक्टीरिया also called wind, virus also called wind, pathogen is also called wind. These all are external wind. So the meaning of external wind means external air or the outside air. Okay, anything which is creating wind, कोई भी चीज जो wind create करे, कोई भी चीज, like if you are taking bath with the cold water, if it is creating the wind, हम ठंडे पानी से नहाएंगे और पता चला कि दर्द चालू हो गया, विंड बढ़ गई, दैट इज एक्सटर्नल विंड, राइट. इफ यू आर ईटिंग लॉट्स ऑफ ड्राई, रूखा सूखा food, it might create external wind. And there is a bacteria, virus, pathogen, when they are attacking the body, जब ये हमारे शरीर को अटैक करते हैं, तो बैक्टीरिया को हम क्या बोलते हैं? हम बोलते हैं एक्सटर्नल विंड. वायरस इज विंड, पैथोजन इज विंड. Okay, these are the outside factor. But these outside factor can create lots of disease. Maybe they can create fever, maybe they can create cough and cold, rhinitis. But when there is a generation of internal wind, it can create paralysis, hemiplegia, coma, unconsciousness. So external wind might create bacterial infection, viral infection, okay, pathogenic infection. But because of the external wind, if there is a generation of the internal wind, then there are chances of paralysis. If the external wind is not creating the internal wind means, what is internal wind? Internal means the wind inside the body. How? Suppose you are not sleeping in the night. Okay, you are not, then wind is increasing. So what is the internal wind? Let's try to understand here what is the internal wind. So look at here, person is not sleeping enough. एक व्यक्ति ठीक से सोता नहीं, right? Then the might suffer with the yin deficiency. because night is yin. And what is yin? If this is the tank, this is the fuel tank. So yin is like a fuel of the human body. Fuel. Fuel is yin. Another example, if this is the one lamp, we can see this is the oil and this is the fire, which is created by the oil. Okay. So this is the small lamp and fire is generated by the oil. So oil is yin and fire is yang. So yin is converting in the yang. Once the oil is finished, then you have to refill the oil. एक बार तेल खत्म हो गया और आपको दिए की आग को जलाए रखना है तो और तेल डालना पड़ेगा, नहीं तो अग्नि बुझ जाएगी. Otherwise, what will happen? The condition might happen like this: the oil is finished, then how you will continue the fire? So fire will not able to continue. In the same way, yin is the fuel of the human body. I want to run, I want to do exercise, I want to go gym. So maybe I will take milk every day. I will take dry foods, I will take protein, I will eat nourish the food because I need fuel for work. मुझे fuel चाहिए. So some person is not sleeping enough and suffering with a fuel deficiency or the yin deficiency, or maybe person is not eating enough, or maybe person is eating but not eating nourishing food. Maybe person is going gym, doing daily 2 hour workout, 1 hour workout. Then when we are doing gym, when we are doing workout, we are in the body is demanding more calcium, more nutrient. And if the person is not taking, then person will suffer with the weakness, tiredness, hair fall. क्योंकि आप अगर आपने कहा मुझे आज कार चलानी है 500 किलोमीटर, you want to run the car 500 kilometers, then definitely you have to put the fuel little more. In the same way, you want to run the body 1 hour for gym and you want to work throughout the day, physical work, mental work, or you want to play the badminton for 2 hours, you need more energies, you need more fuel. You might have to take the more protein, more calcium, milk, some good food, right? So other person is not doing anything, just sitting and not doing anything, maybe need less energies. उसको कम ऊर्जा की जरूरत है. So now, if the person is suffering, person is doing more work, workaholic in the nature, not sleeping enough in the night, or not taking the nourishing food, suffering with the fuel deficiency or the yin deficiency. So what will the fuel tank? Fuel tank previously was like this. This is the fuel tank or the yin tank. Previously there were good fuel, but now you have not slept enough. So now fuel consumed. Fuel consumed. In the empty space, what is there? In the empty space, there is a air or builder. क्योंकि जिसमें कुछ नहीं होगा वहां क्या होगा? हवा होगी. So this is called, due to the not sleeping enough, you are suffering with the yin deficiency, right? एक व्यक्ति ठीक से नहीं सोया. अब मैं दिखाता हूं. The pattern number 1. The pattern number 1, I will show you here. Person is not sleeping enough and suffering with the yin deficiency. There might be many yin deficiency. Suppose this person is not sleeping enough and suffering with the liver fuel deficiency, liver yin deficiency. Workaholic person are having this pattern. जो लोग ज्यादा वर्कोलिक होते हैं. Then what will, then comparatively if the yin is deficient, then there is a liver yang rising. We can understand in this way. This is your home. In the home you are having air condition, but it's stopped working. Then you will be feeling heat in the room. So if your yin is not working enough, then there is a yang is rising. Yang बढ़ जाएगा, और yang जैसे ही बढ़ता है, yang का अगला काम है internal bind बढ़ाना. That's why the person is not sleeping enough or workaholic in the nature or having liver deficiency. There might be liver yang rising, liver का yang बढ़ेगा और फिर बिंड बढ़ेगा और उसे हेमिप्लेजिया हो सकता है. For example, if you see, just imagine one building with a fire and fire brigade machine that around. एक बिल्डिंग में आग लगी हुई है, आप पास में जाओ तो कैसी गरम गरम लपटें आती हैं, पास में आती है कि नहीं आती. So when there is a rising of the liver yang, even it will create bind, lots of bind. You can't survive there, you can't stay there, right? So fire will be creating bind. And what is the next? Hemiplegia. So I was telling you, as per the TCM, when we talk about the paralysis, we first thinking, okay, bind, heat, hotness, humidity, dryness, coldness. Okay, who can create the paralysis? Bind can create the paralysis. So one pathogen can create the paralysis. If pathogen will attack, if the external bind will attack, no, pathogen cannot create paralysis. Pathogen paralysis create नहीं कर सकता. Who can create the paralysis? When there is a internal bind is rising. अब अंदर की बिंड कब बढ़ेगी? जब फ्यूल टैंक खाली होगा. आपका फ्यूल टैंक जब तक भरा है, आपने बढ़िया तेल लगा के खूब मालिश की, सिर की, नाक में तेल डाला, कान में तेल डाला, है ना, आपने घी का सेवन किया, रोटी में घी चिपड़ के खाया और खूब अच्छी नींद ली, पैरालिसिस होने का सवाल ही नहीं उठता है. You will not, no, you can't get paralysis, right? When the person is getting paralysis, not eating nourished food, suffering with the not sleeping enough in the night, day-night working, maybe on the mobile, on the laptop, so consuming entire liver yin, and this condition is continue for many months. ऐसे एक दो दिन की बात नहीं है. It's not about the 1 or 2 days. It might be about 2 years. The person in the same mode, or maybe 6 months. So chronic liver yin deficiency will create this problem. Only chronic. यानी ये चीज कई समय तक रहना चाहिए, राइट? कभी कभी तो आप कहीं जर्नी कर रहे हो, नहीं सो पाते, चलता है, कोई प्रॉब्लम नहीं. इट्स नॉट द प्रॉब्लम, राइट? सो नाउ this person who is having the liver deficiency, already having liver deficiency, right? So having internal, slowly, there is a liver yang rising, internal bind, and it will create hemiplegia. So this is the cause number 1, right? कैसे पहचानेंगे आप इन पेशेंट्स को? How will you recognize these patients? If you see the tongue, so tongue is generally red, here you will see no coating on the side of the tongue, especially on the left side. Or maybe we can see no coating this side, even this side. On the side, no coating on tongue. यहां पर आपको कोटिंग का अभाव मिलेगा, तो ये साइन है लिवर इन डेफिशिएंसी का. समटाइम यू विल सी the entire tongue is not having coating, no coating. So yin deficient pattern. So these person might get many problems because of the yin deficiency. So we were discussing about the cause number 1, how the internal wind is created if the fuel tank is empty. Now the same thing we will understand in a different way. Like suppose if we talk about the females. Now this is the condition number 2. We talk about the females. Female is having menstrual period every month. Female को हर महीने menstrual cycle होती है. They are losing the blood every month. So female are losing lots of blood every month. This is the cause number 1. Cause number 2, they are not taking good food, nourishing food, or they are also not sleeping enough. They are not sleeping enough. They are not. So why anyway if they are suffering with the liver blood deficiency? अगर किसी कारण से उनके अंदर ब्लड की कमी हो जाती है, लिवर ब्लड की कमी हो जाती है, राइट? So if the liver blood deficiency, again the same pattern. What is the same pattern? So this is the liver. Liver is storing blood. Liver blood को स्टोर करता है. In the night, all the extra blood coming to the liver, जितना भी extra blood होता है वो liver में आ जाता है. And there is a detoxification process going on in the liver. तो रात में आपको पैर नहीं हिलाना, आपको हाथ नहीं हिलाना, आपको खाना खाने के लिए मुंह भी नहीं हिलाना. You don't have to speak. So body is not sending blood to the legs, arm, mouth. So the all the blood not needed to send anywhere, going in the liver. So liver is the storehouse of blood, and every day liver is taking judgment. Okay. कहते हैं ना कि घर में एक हॉस्टल में 100 बच्चे रहते हैं, रात को काउंटिंग हुई, अरे हाँ पूरे 100 बच्चे हैं. So liver is also doing counting every night. Okay, good hemoglobin, good blood we have. But suppose by chance person is suffering with the liver blood deficiency. Okay, तो liver क्या करेगा शुरुआत में? Liver will count. Okay, 1, 2, 3, 4. Oh, 92. It should be 100, for example. 92. Where 8% gone? 8 लोग कहाँ गए? So liver will try to pull from the leg, liver will try to pull from the arm. The person will be getting cramps in the leg in the night. Cramps in the leg. अब वो liver खींच रहा है, कुछ है ही नहीं, blood कहाँ से खींचेगा? Cramp आएगा तो. So person will be having cramps. Why the cramps? Because liver is trying to pull some blood, but already having some deficiency. It might be blood deficiency, it might be calcium deficiency. Okay, so we have to work on that deficiency. हम उस deficiency पे work करना है, क्योंकि रात को क्या होगा कि फालतू की चीजें. So there are many things going in the liver. So now there is a responsibility of the liver to detoxify each and everything, because liver हमारे शरीर में लिवर एक बहुत ही महत्वपूर्ण ऑर्गन है। कितना वेट होता है लिवर का? व्हाट इज द वेट ऑफ द लिवर? कैन यू टेल मी? अब देखो, अपने लिवर का नाप के देखो वजन, ऐसे नाप के देखो कितना है। हाथ लगा के वेट करो। इन द बुक्स इट्स रिटन 1.5 to 2.5 kg, मे बी 3 kg ऑल्सो। समझो कि 3 किलो का, एक 3 किलो का डंबल आपके पेट से लटका दो, फिर चलवाओ आपको। सो दिस इज द रियल वेट ऑफ द लिवर, बट इफेक्टिव वेट इज ओनली 400 ग्राम। इफेक्टिव वेट का मतलब है कि liver is located there. So now someone pulling this side, someone pulling that side, someone pulling upward, someone pulling downward. There are lots of different pressures. So effective weight of the liver is only 400 gram. That's why we are not feeling any burden. इसलिए हम कोई burden feel नहीं करते यहाँ पर, right? But in the condition, if liver is having some disharmony, suppose some ligaments holding the liver is weak, some fascia around the liver is weak, some structure around the liver are weak, then you will start feeling heaviness in the liver. Then you will start feeling more weight in the liver. अब यार डेफिनेटली मैंने गाय और भैंस के लिवर से तो कंपेयर नहीं किया, मे बी आई विल सी, बट ह्यूमन लिवर इज डेफिनेटली वेरी वेरी स्ट्रांग, बिकॉज ह्यूमन लिवर को बहुत मेहनत करनी पड़ती है। वो अल्कोहल भी पीता है, गाय भैंस कभी अल्कोहल तो पीती नहीं है ना। उसको खाना भी खाना है, घी भी खाना है, और दारू भी पीना है, और बेचारे एक ही लिवर को सब काम करना है, सब हैंडल करना है। फाइन। सो नाउ if the liver is getting, if the person is having blood deficiency, it might be happen with male female anyone, but female are more prone, फीमेल ज्यादा prone होती हैं। So suppose one female is suffering with the liver blood deficiency. Again, we can imagine same. This is the, previously there was good blood, but now the amount of the liver blood is reduced. अब liver blood reduce हो गया. In the empty space, what will be there? In the empty space there is a bind. खाली जगह में क्या होगा? खाली जगह में बिंड होगी. So liver blood deficiency also will be responsible for liver bind rising. ये भी liver bind के लिए जिम्मेदार होगी. So this is the second condition. Liver blood deficiency, maybe with the male and female anyone, will generate the liver bind. अब व्यक्ति को होगा shaking head, tremor and tics. तो ये सिंपल सा कारण है. आपके पास कोई पेशेंट आता है जिसका सिर हिल रहा है, दैट इज इंटरनल बिंड, है ना. किसी को ट्रेमर्स आ रहे हैं, दैट इज इंटरनल बिंड. टिक्स, टिक्स का मतलब है या तो आंख में या गालों में, आंख में से ऐसे टिक्स, गालों में से. सो दी आर द इंटरनल बिंड, है ना. अब पवन जी को आ गया कभी भीड़ में तो क्या होगा समझिए. पवन जी कहीं गए थे, भीड़ में फीमेल्स के बीच में बैठे थे, और पवन जी को टिक चालू हो गया. तो तुरंत इन्हें क्या करना होगा? लिवर ब्लड डेफिशिएंसी के पॉइंट लगाने होंगे. अपना लिवर बढ़ा. देखो, पार्किंसन इज ए डिफरेंट कंडीशन. पार्किंसन इज a different condition. Here we are talking about the liver blood deficiency. You know, many females are telling, I am having numbness here. मुझे यहाँ पर numbness आ रही है. क्यों आ रही है numbness भाई? What is the cause of numbness? Most of the female are having numbness on the face because of लिवर ब्लड डेफिशिएंसी क्रिएटिंग बिंड। और अगर आपने इसे ठीक नहीं किया तो पहले वाली कंडीशन और ये दूसरी वाली कंडीशन दोनों में से कोई भी पैरालिसिस कर सकती है। इट माइट क्रिएट पैरालिसिस, previous condition and this new condition, right? Because ultimately something is getting deficient, so bind is rising, बिंड बढ़ रही है। इज इट क्लियर? आपको फाइंड आउट करना पड़ेगा पैटर्न। तो ये हमने समझ लिया कि शेकिंग ऑफ द हेड, ट्रमर्स एंड टिक्स आर, if the sudden numbness in the thumb, yeah, is it, there are chances of the liver bend, yes, but numbness in the thumb also might be the compression of the cervical nerve. There is a, because cervical nerve, okay. I will tell you कि लिवर ब्लड डेफिशिएंसी की हम बात कर रहे हैं, हम ब्लड डेफिशिएंसी की बात नहीं कर रहे। इन द एक्यूपंक्चर वी टॉक अबाउट लिवर ब्लड डेफिशिएंसी, हार्ट ब्लड डेफिशिएंसी, वी टॉक और नॉट, हम बोलते हैं कि नहीं? When we talk about the blood deficiency, we are not talking about the hemoglobin. Patient will come to you with the tics or the numbness on the face. आप बोलोगे कि आपको ब्लड की डेफिशिएंसी है, पेशेंट बोलेगा कि डॉक्टर साहब मेरा तो हीमोग्लोबिन 12.5 है। फिर तो ये तो दिमाग से निकाल ही देना, नहीं तो पेशेंट ही आपकी क्लास ले लेगा, है ना। आप बोलोगे ओ यू आर सफरिंग विद द लिवर ब्लड डेफिशिएंसी, because liver blood deficiency is the TCM term. TCM term means wherever the liver is connected, there are bind is rising. Bind is rising, right? So don't consider this. No, blood deficiency means not the heat. देखिए हीट अलग चीज है। आप एक बात समझिए कि हीट का मतलब क्या है? हीटर चल रहा है रूम में, that is heat. Blood is the very important thing. Blood is giving nourishment. Definitely blood is hot, blood is having heat, but blood is giving you nourishment. Okay. So now, there are mainly, we are talking about कि पैरालिसिस होती है तो बिंड बढ़ने से होती है। The paralysis is happening due to the internal bind. So right now we are just going and discussing the general causes. हम सिर्फ जनरल कॉज समझ रहे हैं। हमने पहला समझा कॉज बिंड बिकॉज ऑफ द लिवर इनडेफिशिएंसी। हमने दूसरा कारण समझा बिकॉज ऑफ द ब्लड डेफिशिएंसी, कॉज नंबर 3। ऐसे 3-4 कारण अभी हम समझेंगे। द कॉज नंबर 3, नाउ person is having liver bind, it might be because of any reason, कोई भी कारण से हो सकती है। as per our discussion, it might be because of blood deficiency, liver blood deficiency, it might be because of the liver yin deficiency, किसी भी कारण से या और भी किसी कारणवश अगर हमारे शरीर में लिवर बिंड बढ़ गई, in the 5 element cycle we know liver, heart, spleen, lung and kidney. If the liver bind is high, it might create heart bind. अगर लिवर में बिंड बढ़ गई तो ये हार्ट में बिंड बढ़ा सकती है। Then as soon as the heart bind is rising, person start doing irrational speaking and continuous muttering. व्यक्ति को चुप कराना बहुत कठिन हो जाएगा। ऐसा व्यक्ति बोल 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 करता रहेगा, बोल 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 बोल। So as soon as you find some patient is speaking a lot, too much speaking, irrational speaking, यानी ऐसी बातें बोला, बेतुकी बातें जिसका कोई संबंध नहीं है, तुरंत समझ जाइए इसकी लिवर बिंड बढ़ी हुई है और हार्ट बिंड को बढ़ा रही है। आगे इसको पैरालिसिस ना हो, इसके लिए अभी से लिवर बिंड को कंट्रोल करना पड़ेगा। दिस इज अ वेरी वंडरफुल TCM concept to diagnose the things. Maybe person is speaking a lot and doing unwanted speaking and telling you, doctor, I'm suffering with the tics, I'm suffering with the numbness, I'm suffering with some problem, and doing irrational speaking, यानी फालतू की बातें कर रहा है, बस बोल 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 बोल, कीप ऑन स्पीकिंग, कीप ऑन स्पीकिंग, then you should understand this thing, arrest the liver bind quickly. आपको लिवर बिंड को क्विकली अरेस्ट करना पड़ेगा। ना द फोर्थ, तो हमने तीन कारण समझे। कौन कौन से तीन कारण है बताइए? पहला कारण कौन सा था? क्योंकि चौथा कारण बहुत ही महत्वपूर्ण कारण है, उसके पहले मैं तीन कारण आपसे। पहला कारण क्या था? लिवर yin deficiency creating internal bend and might create paralysis, hemiplegia. Cause number two, cause number two is liver blood deficiency might create internal bend, liver bend, and might create shaking of head, tremors, tics. Okay. अब आपके पास कोई पेशेंट आता है टिक्स को लेकर, तो आपको समझ जाना पड़ेगा लिवर ब्लड डेफिशिएंसी, liver bin ticks, and so you have to understand this diagnosis and do the treatment. We will understand. Okay, this is a tick. Second thing. Third thing, liver bin is rising, which is creating heartbeat. Then person is doing continuously muttering, कुछ ना कुछ बोलना, keep on speaking. Now we are talking about the fourth and very important cause. Very important. Yeah, even laughing, हार्ट से लाफिंग भी आ सकती है। So there are mainly four causes, and the fourth cause, extreme heat. Extreme heat because of anything, maybe some bacterial attack, maybe some viral attack, maybe very high fever, कि बहुत हाई फीवर हो गया। एक व्यक्ति को मलेरिया हुआ और 3 दिन सोया नहीं, द पर्सन इज नॉट स्लीपिंग 3-4 days after the malaria fever, after the dengue fever. Why not sleeping? Because of the high fever and because of the medicines and because of something, not able to sleep for many days. Okay, so doctor also giving sleeping pills for few days, for 3 days, 2 days. Okay. But suppose some doctor is not giving sleeping pills and person is not sleeping for many days and fever is very high, maybe viral fever, malaria fever, dengue fever, some different type of the fever, then fever might go and become the brain fever. वो फीवर ब्रेन फीवर बन सकता है, जिसे कहते हैं सेरेब्रल फीवर और द ब्रेन फीवर। ब्रेन में फीवर कहाँ आता है? ब्रेन की हड्डियों को आता है क्या? ब्रेन में फीवर आता कहाँ है कि कहते हैं ना ब्रेन फीवर। सो व्हाट इज द मीनिंग ऑफ ब्रेन फीवर? इन द ब्रेन we have bony part, outermost bones, then we have layers, membranes, they are called meninges. हमारे ब्रेन में मेम्ब्रेन होती है DAP, ड्यूरा मैटर, अरेक्नोइड मैटर, पाया मैटर, 3 मेम्ब्रेन होती है। ड्यूरा मैटर, अरेक्नोइड मैटर, पाया मैटर। सो ड्यूरा मैटर, अरेक्नोइड, दे आर द मेम्ब्रेन्स। देन द ब्रेन इनसाइड, फिर उसके अंदर ब्रेन होता है हमारा सेरेब्रम, वो हमारा पूरा ब्रेन। तो फीवर किसको होता है? बाहर की बोन को होता है, ये मेनिंजेस को होता है, कि अंदर होता है? सो फीवर होता है इन मेनिंजेस में। So that's why brain fever is also called meningeal fever. Meningeal fever. जब भी किसी को ब्रेन फीवर होता है तो ये ड्यूरा मैटर, अरेक्नोइड मैटर, पाया मैटर यानी इनमें होता है, जिसे कहते हैं मेनिंजियल फीवर। कब होता है? अगर आपने किसी के फीवर को समय पर कंट्रोल नहीं किया, if you are not able to control the fever on the time, the too much heat will create the internal wind, and now it will convert in the brain fever. वो जो हवा होती है ना अंदर की, वो गर्म हवा होती है, जैसे कि एक बिल्डिंग में आग लगी है, उसके आसपास कैसी गर्म गर्म हवाएं चलेंगी। सो व्हेन देयर इज ए too much high fever, very high malaria fever, और उसने कर दिया ब्रेन फीवर, मेनिंजियल फीवर, मेनिंजाइटिस, और अगर नहीं कंट्रोल हुआ तो मिर्गी के झटके, इपिलेप्सी, सीजर्स, many kids are getting seizures if you are not controlling the fever. सीजर्स कि फीवर को समय पर कंट्रोल नहीं किया तो ब्रेन पे चढ़ जाएगा और मिर्गी के झटके आएंगे, फिर सीजर्स आएंगे। व्हाट इज दैट? एज पर द टीसीएम, हाउ विल एक्सप्लेन दिस? टीसीएम के अनुसार हम कैसे एक्सप्लेन करेंगे इस चीज को? और टेटनस, टेटनस इज द डिसीज we can explain here. So let's see here now. Extreme heat, maybe very high fever, 105, 106 fever or more than that, generate liver wind, कि इतनी लिवर विंड पैदा होगी कि उससे व्यक्ति कैन गेट कन्वल्शन, मिर्गी के झटके, सीजर्स, ट्रेमर, even coma. Epistotonus. So I will show you this image. Look at here. This is the epistotonus. Tetanus. बॉडी ऐसी कड़क हो जाती है विंड के कारण. द नेचर ऑफ विंड इज क्रिएटिंग स्टिफनेस. विंड का एक नेचर है कड़कपन पैदा करना. So this is body is becoming like this in the tetanus or epistotonus. और द कन्वल्शन, मिर्गी के झटके, कि ब्रेन पर फीवर चढ़ गया भाई, मिर्गी के झटके आ रहे हैं, टेटनस हो गया. very high fever, viral infections, tetanus, meningitis, encephalitis, brain का infection, inflammation, brain fever, seizure. These all are the reason very extreme heat. Maybe because of high fever will create internal liver wind. तो जब भी डॉक्टर के पास आप जाते हो तो डॉक्टर हमेशा बोलते हैं कि भाई ध्यान रखना, 104 बच्चे हैं तो भाई 105 से ज्यादा फीवर ना हो. इफ वी आर एडल्ट then we should not get more than 103 fever. If the fever is going more than 103, then there might be this condition. The too high fever will create liver wind, and liver wind is responsible for tetanus. बॉडी कड़क हो जाएगी धनुष की जैसी. The liver wind is responsible for very high fever, meningitis, encephalitis. So this is a very dangerous condition. Why this is the dangerous condition? Look at this chart. कि कहते हैं कि हमारे शरीर में जब भी कोई पैथोजन का आक्रमण होता है तो उसे 4 लेवल से गुजरना पड़ता है. There are many other theory, there are many different theories, but right now I am talking about the 4-level theory. The pathogen has to go through with a 4 level, like defensive defensive key level, nutritive level, and very deeper blood level. That we'll discuss in the next class. 4 level we'll discuss in the next class. Right now I'm telling, when there is very high fever, the heat, because of the heat, the infection is reaching on the 4th level, the last level. That's why high fever is very dangerous and it will create too many problems, right? So today we have discussed 4 causes. In the next class, we will discuss the treatment of all the 4 things. अगली क्लास में हम चारों का ट्रीटमेंट समझे. ओके, मे बी ये सब चीजें हम TCM में भी पढ़ चुके हैं. This for if you have already attended the TCM program, this is just a repetition for you, right? So there are 4 things we have to understand creating the internal bind. Number 1, liver iron deficiency. Number 2, liver blood deficiency. Number 3, bind because of any reason, then it is converting in the heart wind. And the 4th cause may be very high fever, may be very high heat, also creating liver bind, right? तो आपको 4 कारण याद रखने हैं. 4 लाइनें आपको अपनी बुक में लिखनी है और एक फोटो क्लिक करके ग्रुप में डाल देना है ताकि थोड़ा सा याद हो जाए. तो अगली क्लास में हम इन 4 का पहले treatment समझेंगे. We'll understand the treatment of these 4 conditions because there are many more conditions will be coming very shortly, right? So thank you so much, everyone. Let's conclude the session and see you in the next class. All the 4th condition might happen with a male, female, kids, and old, anyone. So just I told you the tendency who might get the specific conditions. कि बच्चों को जब the kids having more capacity to wear the fever, बच्चों का फीवर 107 भी चला जाए तो भी बच्चे बच जाते हैं, कुछ नहीं होता. In the adults, if fever is going till 105 now, then it's very dangerous. Kids are having more like capacity. Their body is like that. Okay? Done. अभी सदी जी अगर हम आयुर्वेदा की बात करेंगे तो सब लोग कंफ्यूज हो जाएंगे. Okay? क्योंकि कहते हैं कि विंड प्लस फायर, वादा एंड पित्ता. यस, राइट, यू आर एब्सोल्युटली राइट. It will create dhatu क्षय. Okay, husband is got 107 fever. Yeah, it's really not the safe zone, but many persons survive. Okay, done. Thank you so much. We'll discuss the treatment. No, it is not a fever gone. There is no effect now. Don't think in that way कि फीवर पहले 107 हुआ था अभी कोई इफेक्ट होगा क्या. नो, नथिंग लाइक दैट. उसी समय होता, उसी समय जब आग लगी है तभी बिंड होगी. ऐसा नहीं होगा कि आग लगी थी 10 साल पहले अभी भी क्या लिवर बिंड होगी. ऐसा नहीं, कुछ नहीं, ऐसा कुछ. डोंट वरी फॉर दैट. ओके, सो डन फॉर टुडे. We'll see you in the next class. Thank you so much. Next class.